I recently wrote an article for NDNR on long-haul COVID and oxaloacetate. We know 6% of the population suffers from some level of long-haul COVID, everywhere from brain fatigue, brain fog, onwards to physical fatigue. And the question is, what's the role of oxaloacetate? That's what I covered in the article. Research shows that those individuals suffering from myoencephalitis as well as chronic fatigue syndrome have lower oxaloacetate. We also know that a reduction of chronic inflammation via NF-kappa B is associated with the application of oxaloacetate as a supplement. It also increases NADH ratio by 50%, increases mitochondrial biogenesis, reduces glycolysis in the Warburg effect, increases mitochondrial energy production. So it has a lot of applications. It's foundational, addressing the cause of what's going on. There's a lot of research. One study is called Restore, the other one's called Regain. And the reality is it's been shown that within merely 42 days, the vast majority of people were actually feeling better. Their cognition was better and overall symptom burden was less. Also, what we found was that in that trial, the fatigue improved and significant improvement in cognition within weeks. Our patients suffering want results. They're desperate, but they have spent so much time and money. Isn't it great to have a tool that, if it's going to work, it's going to work in a noticeable period of time? The research shows the oxaloacetate group maintained a significant improvement of some 25% over the baseline fatigue levels throughout the study. And as you can see on this graph, the normal ups and downs of crashes and a little hope, and then there's another crash. Well, the general population, 25% of the participants, actually had improvement across the board. However, the enhanced responders, which were 40.5% of the patients, actually had a 63% improvement in symptoms. And once again, helping prevent that ebb and flow that we see a lot of times with our patients with chronic fatigue. So as you can see here in this study, you can see the oxaloacetate, the peach-colored line, and a dramatic improvement in the reaction time of the brain. When we're having brain fog, what do we have? We have a slow, dreary mind. We want to see that improvement. This is what I'm seeing in my clinical practice as well. This is oxaloacetate that I use in my clinical practice, and it actually has received a structure function claim from the FDA, allowing it to have the following claim. Oxaloacetate may help alleviate physical and mental fatigue associated with myalgic encephalomyelitis and chronic fatigue syndrome. This is a medical food. It does not require prescription. It does require us to prescribe it or recommend it, and of course it requires medical oversight since it is a medical food. If you have any further questions, I'd love to answer them. I love talking with colleagues. My name is Dr. Chris Meletis, and my email since the mid-1990s is naturalmedman@hotmail. Look forward to hearing from you. I can share the articles with you as well. Thanks.